Okay, I am going to go ahead and ask if there is a table or a couple of tables that would like to share out some of your conversation. And it would be great if you went to the mic if you wanted to do that. Okay, great. Thank you.
Hi guys, my name's Kristen. I'm from Cincinnati. I'm a school counselor. Hi. I work in career tech. I'm here with Sarah Wilson, my daily partner in crime. She's one of our assistant principals. So we are a small part of a little larger group that is really pushing mental health, social emotional in our building and in our district. And some of our work has already caught fire to the other campuses, so we're pretty proud of where we are now and where we're going, and that's why we're here. Neither one of us have been to Texas before, so it's like we're first-time Texans. And so I'm going to talk about taking action. Is that right?
Yes, please.
Okay. So one of our taking action steps, and it's slow but intentional work, is developing the SHAPE program and creating that with our building and then hoping that it grows to our district, and taking an approach with the adults in our building with SEL and kind of integrating that into their culture so that then hopefully they'll integrate that into their classroom cultures, and also help them enjoy life better. Yeah. As a school counselor, one of my goals is to reduce non-school counselor activities and work on this stuff instead. For instance, testing, scheduling, 504 case management, English language learners case management, that kind of those unfunded areas that kind of get shoved off to professionals like me that wear lots of hats. But then I can't wear my hat, so we're working on that too. And I'm very lucky to have great administration. Obviously, we're here, so that's something. Shout out to Sarah Matthews from Colorado. I liked what you said, and I'm coming for you, so I'll be emailing you. We'll be emailing you to get some more thoughts and ideas about some of the things you shared today.
That's great.
Although Ohio is a red state right now and we're not really crazy about marijuana. Although medical has passed. Medical has passed. Okay, things that I can do to work on my state and region is continue the daily work of not taking no for an answer with my team, and leadership in professional organizations, being a mentor to other school counselors and educators, and voting for public education on the local, state, and national level. And one thing that I have kind of submitted myself to doing is being a participant in educational research. Not as a researcher, but as a professional that can be questioned and that kind of stuff.
Thank you. Thank you. Do we have one other table that might be interested in sharing a little bit? I know. Come on. I know you're sugar low, but okay, awesome. Thank you. Do it.
All right. I'm also just using this as an opportunity to stand. It's really selfish. My name is Leora. I'm the school mental health lead for the Pacific Southwest Mental Health Technology Transfer Center with my colleague, Dr. Christina Borbet, and we work for the Center for Applied Research Solutions. And that was a lot of acronyms. Los Angeles. My voice is hoarse because we've been training a lot. So we had a super fierce table. Ate the great. We had a super fierce table. And part of what rose to curiosity for me as a listener today was how we can create space to really tap into the abundance of resources in this room, the wisdom in the collective. I'm just feeling like, so leaving with a little bit of that, and also leaving with a lot of kind of my own, I think I use the word impatience, but call to action around really being intentional in how our practice reflects the principles that we are also promoting in service delivery. So there are a lot of fundees in the room, there are a lot of funders in the room. What does it look like to actually have a trauma-informed funding relationship? I'd really love to hear about that. I know some of y'all's tea, but I'm sure we could spill more. But really learn, I mean, I'm saying that respectfully, like really learning what that feels like and looks like. I'm looking at you to cue me. I heard that there was a desire to talk about centering like real equity, not just equality, but real equity as the foundation of this practice. And we talk a lot about in our training how the original ACE population was middle class, white, and insured folks, and we quickly, because of the operations of white supremacy, changed and switched our gaze to folks of color, and really didn't do a lot of work around talking about the social determinants of health as it intertwines with the study. And we're grateful to RISE and the folks in Richmond that are really lifting up a critical analysis of adverse community and childhood and climate experiences. And breath. I'm really hoping that in the future we can not just say, like, we need to get to that, but actually center it and use that as the framework moving forward and get more skilled in our own dialogue. And...
The intersection of death and loss.
Okay, great, thank you. And also, I'm sitting, Dr. Blau, we're so grateful for the slide, and I'm hoping it's either yours or someone else that we can credit. The slide of really disaggregating abuse, loss, and chronic stressors. And part of the work that we've been playing with in some of our modules is having folks in the room really suss out what are the intersections and what are the differences between trauma, grief and loss, adolescent behavior and development, like healthy youth development, and trauma.
Spirituality, immigration.
Well, no, wait, that's my second bullet. Anyway, but like really actually doing some of that unpacking, and particularly because coming from California, we have this huge push this coming year in screening, and there's like so much in stuff about screening, and I'm also just curious from a research to practice intersection, like how can we lift up what we don't know? Like how much do we not know about what is a mental health challenge versus what is trauma versus what is grief versus what is adolescent development? So that, and then the last piece was just my own interest in really centering immigration and centering religious communities and experience of this conversation, so that we can kind of like get through the dominant narrative and actually get through a lot of communities that are really experiencing the impact of the dominant narrative, and doing some interruption in our own assumptions of what mental health even is, looks like, and should feel like. Period.
Awesome. Thank you. Thank you. And thank you for everyone that's in the room that stayed post-lunch and heard the last panel and participated in this. I'll just share a few reflections of my own about today. I want to sort of double down on the staff trauma and providing supports for adults that are engaged in this work. I think I heard about it at our table. We heard about it throughout the day. And Casey at our table said that for 8 hours a day she's with kids, and that pressure to fix them, fix what's happening is incredible. And so we certainly need to support folks that are working day to day on the ground with this, with these issues and children and families. I really appreciated the focus on the systems today in terms of looking at this through children's eyes, and Elizabeth's using her son as a vehicle to really highlight for us where these systems, as close and as well-intentioned as they are, just don't quite rub the right way with each other, and where we're leaving that gap for young people, which I thought was very powerful. Also, we heard about stealing shamelessly and sharing seamlessly, and I love that motto. I'd like us to use it, and I'm hoping people do that today. Walk away with that. changing the minds of superintendents, principals, and others to think about early childhood as part of their accountability and not just somebody else's, I thought was an interesting point. And then that conversation around high-value care and in the inclusion of equity and prevention as we think about high-value care, I thought were some of the really great takeaways for today, and there were so many others. I also took a look at our word clouds from the poll this morning around what folks wanted to get out of the day and what folks gave or wanted to propose to give. And I actually feel like we were really on track. People were interested in listening to successes and hearing some of the challenges. I feel like we've done that. Connecting with colleagues, hearing about innovative ideas, learning about resources. Dr. Blau's PowerPoint, which you'll all receive in a few days once we get materials going out to you via email, will include some of those resources that he posted up there. So I want to thank all of you for attending this pre-conference session and being with us today and learning today. The conversation really can continue on Twitter. Folks may have been tweeting during today, but the hashtags are Building Resilience and hashtag KPIHP if you'd like to continue that dialogue in that way. So to wrap us up, I have some thank yous. So obviously I need to thank our moderators and our speakers for coming out and really sharing your work and your passion on this issue. It was really an inspirational day, so please help me thank everybody for their time. I want to thank the National Center for School Mental Health and the Alliance for Healthier Generation and the Healthy Schools campaign, because without their thought partnership, we wouldn't have been able to pull today together. So we really appreciate your spending time with us on the phone and certainly being here today with us. We also have a number of folks from inside Kaiser Permanente that were really instrumental in today. Dr. Don Mordecai, that you heard from, is just leading the work for Kaiser Permanente nationally, and certainly I think it is having an impact in this space way above and beyond folks at Kaiser Permanente. So I want to thank you, Don, for your leadership in this space. Thank you. We also worked closely with folks from our Thriving Schools program, from our Office of Transformation, and other parts of the organization, communications, et cetera. I really want to thank all of you for all of your support. For the Institute for Health Policy staff, especially Renee and Megan that are here doing this, we absolutely could not do this without you. And then we want to thank Hilton for being such gracious hosts. I want to thank Spark Street Digital. I want to thank Marilyn Arciaga, who's also helped with the event coordination, and Aaron Scott, who has been documenting today. Thank you for doing that. So with all of those thank yous, again, I want to thank all of you for being here today, for joining us. You, as I mentioned, will see an email from us with a survey asking for your input on how today went. We'd love to hear from you. We definitely use that input to guide our thinking around future events, not just operations and logistics, but content as well. So thank you all, and I hope you enjoy your rest of your time in Austin. Thank you.